Hi, I'm Katie Marble, a public health nurse with Defiance County Health Department. Today, I'll be discussing falls prevention programming at Defiance County Health Department. A brief overview of topics I will cover include the context of older adult falls, current evidence-based falls prevention programming offered, and partnerships within Defiance County. Falls in older adults are a leading cause of unintentional injury in Defiance County. In a 5-year average, in Defiance County, falls accounted for almost 38% of unintentional deaths. Falling is not a normal part of getting older. There are steps older adults can take to prevent falls and reduce risk of injury or death. Defiance County Health Department has been working on falls prevention since the 2015 Community Health Assessment completion and the implementation of the 2016 through 2018 Community Health Improvement Plan cycle when injury prevention was identified as a strategic priority. As a result, the Power Defiance County Coalition began work through the Injury Prevention Work Group, which included staff from Defiance County Health Department, ProMedica Defiance Hospital, and Community Memorial Hospital. These agencies began reviewing data collection sources, what data was being collected, and current programming in Defiance County. So what do we know? According to the CDC, 1/2 to 2/3 of falls occur around the home. 75% of falls occur around the home during routine activities. Falls don't just happen. They are often a combination of risks coming together. Falls are common, predictable, and largely preventable. Falls are not a natural or normal part of aging. What's the problem? 1 out of 4 adults 65 years and older fall each year. 3 million are treated in emergency departments. Falls account for the most frequent cause of traumatic brain injuries, or TBIs, for adults greater than 65 years of age. The average hospital cost for a fall with injury is $30,000. Falls equate to $50 billion in medical-related costs every year in the U.S. What's a solution? Evidence-based falls prevention programming targets community-dwelling older adults who are concerned about falls and have sustained a fall in the past, restrict activities because of concerns about falling, are interested in improving flexibility, balance, and strength, are age 60 or older, community dwelling, and able to problem solve. Defiance County Health Department recognizes senior falls as preventable and has identified programming to prevent the risk of falls in older adults. These programs include a matter of balance, stepping on, and the dissemination of falls prevention packets. Why were these programs chosen? A matter of balance and stepping on have been researched and proven to decrease falls by up to 31%. Fewer falls means fewer injuries, fewer visits to the emergency room, fewer hospitalizations, and fewer deaths due to a fall. These programs encourage behavior change in participants. The programs take place in community venues, providing expanded access for participants. The efficacy of the Stepping On program supports the idea that cognitive behavioral learning in a small group environment can reduce falls. Before I share details about the programs, I wanted to share our public health nurse team. Again, I am Katie Marbaugh. I became a master trainer for A Matter of Balance in 2016 and a stepping on facilitator in the spring of 2024. Caitlin Roadcap was trained as a coach for A Matter of Balance in December 2022 and became a stepping on facilitator in the spring of 2024. Kaylee Williams trained as A Matter of Balance coach in December 2022. A Matter of Balance is a community-based workshop that can help participants reduce the fear of falling by viewing falls as controllable, set realistic goals, and increase activity, change their environment to reduce fall risk factors, and exercise to increase strength and balance. This class can be taught weekly in 2-hour sessions for 8 weeks or 2 sessions per week for 4 weeks. The class utilizes group discussion, problem-solving activities, action plans, videos, and exercise training to engage participants in this evidence-based program. A Matter of Balance session topics include Session 1, Introduction to Program. Self-assessment and pre-surveys are completed at this session. We also set our class goals in this session. Session 2, Exploring Thoughts and Concerns About Falling. Participants discuss the importance of recognizing their core beliefs about falls before they are able to change them. Session 3, Exercise and Fall Prevention. Coaches discuss the importance of exercise in preventing falls, and participants are guided through exercises for the first time. Exercises will be completed in full at every session following Session 3. Session 4, Assertiveness and Fall Prevention. Assertiveness is woven throughout the sessions, reinforcing that it is okay to ask for help and continue to live our lives the safest way possible. We also discuss low blood pressure and position changes in this session. Session 5, Managing Concerns About Falling. Participants learn how to use a personal action planner to start an exercise program and how to recognize misconceptions and unhelpful thoughts about falling and the effect those thoughts have on feelings and actions. Participants learn how to shift from self-defeating to self-motivating thoughts. Session 6, Recognizing Faulty Habits. In this session, we review our goals from Session 1 and determine what risk-taking activities participants are taking, prioritizing high-risk behaviors to be addressed and changed. Learning to shift from negative to positive or helpful thinking. Participants are required to do homework after this session by completing a home safety checklist. In Session 7, we recognize fall hazards in the home and community. Participants review the home safety checklist and identify strategies to reduce physical hazards in the home and community. Working on our assertive behavior to ask for help when addressing these home hazards. A coach demonstrates a fall in this session and a step-by-step guide on how to get up from a fall. We discussed plans for what participants can do if they cannot get up after a fall. In Session 8, we practice our no faulty habits, fall prevention, putting it all together. Coaches review any materials the participants would like to discuss a little more. Post surveys and evaluations are completed. And then we also do plans for next steps. A guest healthcare professional visits in Session 4 or Session 7 for a question and answer discussion, as well as facilitating a portion of the class. Previously, we've had nurses, we've had fire and rescue, EMT, or paramedic. Most recently, we did have an ER nurse. Stepping On is a high-level, evidence-based community falls prevention program. The course runs for 7 weeks in 2-hour sessions with a follow-up phone call and 3-month post-program booster session. It is multifactorial to include balance and strength exercises, vision and medication management, mobility practice, safe footwear, identifying fall risks, as well as problem solving to manage fall hazards in the home and community. Stepping On is proven to reduce falls by 31%. Benefits include building confidence, greater awareness of risk factors, and fall reduction. The Stepping On program is delivered in 2-hour sessions once a week for 7 weeks. Guest professionals share at 6 out of the 7 sessions. In Session 1, Introduction, Overview, and Risk Appraisal, participants complete pre-surveys and are given the background information for the program. The exercises are led by a physical therapist or occupational therapist. In Session 2, Exercise and Moving About Safely, participants recognize barriers and the benefits of regular exercise. A physical therapist guest expert introduces ankle weights to advance the exercises and demonstrate how to get up safely after a fall. Session 3, Home Falls Hazards. Participants raise awareness to different hazards in the home and recognize hazards in one's own home. Group discusses adaptations and ways to reduce hazards. In Session 4, Vision and Footwear, the vision guest expert, likely an eye doctor, discusses how eye health and poor vision can be a factor in falls. The expert shares things participants can do for eye health, including regular vision checks. Facilitators discuss safe footwear and defensive walking, while also giving participants homework to perform a shoe audit at home. Session 5, Medication Management, Sleeping Better, Calcium, Vitamin D, and Past Participant Sharing. The guest expert for this session is a pharmacist. They share information on regular medication checks, the consequences of multiple medications, and what types of medications increase the risk for falls. The group then discusses sleep hygiene and hear from a former class participant. Session 6, Travel Safety, Mobility Mastery Experiences, and Navigating Inclement Weather. The physical therapist or occupational therapist is back at this session to check on the progress made with exercises. The participants take a field trip outside, guided by the facilitator and guest expert, to master mobility skills, including navigating uneven ground or paths, steps and stairs, grass, gravel, and slopes. Session 7, Community Safety, Talking with Your Provider, Review and Planning Ahead. The safety guest expert, law enforcement or fire and EMS, discusses safety within the community, including pedestrian safety. Facilitators then review the program and finalize plans for participants to continue working on falls prevention strategies. The phone call or home visit is offered 4 to 6 weeks following the class to check in and promotes accountability. The booster session is delivered 3 months following the end of class. With our latest Stepping On session, our physical therapist guest expert offered to do free home visits and home safety assessments for every participant. Defiance County Health Department has collaborated with Defiance Fire and Rescue to provide falls prevention packets to residents that have fallen but are not transported to the hospital. When residents are transported to the hospital, they receive an intervention such as physical therapy, rehab, home health, but the people that are only lift assist do not receive further intervention. According to the fourth quarter Senior Falls report in 2023, a total of 123 people were lift assist and not transported to the hospital, while 212 falls were transported to the hospital. This data is provided by Defiance Fire and Rescue. The falls prevention packets provide a variety of information, including a Matter of Balance class brochures, a list of home care or older adult resources, and study toolkit resources, including a home safety checklist and falls risk self-assessment. The CDC's Stopping Elderly Accidents, Deaths, and Injuries Study initiative comprises 3 core elements: screen patients for fall risk, assess modifiable risk factors, intervene to reduce risk by using effective strategies. Thank you for your time today. I'm happy to discuss this further. Please contact me with any questions.